Hello, resilient souls. Welcome to Neuro Wellness Community's Resilience Resourcing Podcast, where connections empower resilience. This is a connection space where inspiring women and men share their real on their way to resilience. Each episode, I have the pleasure of spotlighting women and men in fields from performance neurotraining to film and all in between. You will get to know the unique tools these individuals each carry and how connecting with these empowering stories bring about camaraderie and in turn empower you toward your unique dreams and goals. Okay, so today I get the opportunity to talk to Laura Currens, and Laura is the owner of Dynamic Flow Physical Therapy, and she also is a pelvic floor therapist. Is that correct?
Yes.
Yeah. Okay. And she's had a journey with going through cancer and overcoming that, and just is an amazing cancer survivor and women's health advocate. And I just wanted to have her on to kind of share her journey through all of that and kind of like what that looks like and how it's changed her mindset and her journey going forward. So, Laura, I've known I've known your family for I don't even know how long now, a very long time. Um, and I know you got your degree in physical therapy and then you had been working in that prior, and then you had, your cancer diagnosis. So kind of start us wherever you feel like starting us in the journey that you went through.
Thanks for having me. I am a pelvic floor therapist. I've been a physical therapist for 16 years, so I was already a PT. I actually started a breast cancer program in San Francisco with a friend,
Wow.
but I never really thought it was not on my radar for me, right?
Yeah.
But I had started that, and then I moved out of the Bay Area to Ventura. And I started working. I had a baby, had my first baby, had my second baby. Life was just really busy. You're working, you're hustling. And then all of a sudden, I just had this weird clogged duct at my nipple line. And I was like, oh, that's super strange. But still, like I said, not on my radar really at all. It was the tiniest little dinky thing. I mean, I don't even know really what clued me in, but something in me intuitively was like, huh, this is really weird. It's not going away. And my milk supply, I was a crazy overproducer. I donated a bunch of breast milk. It
Wow.
was just a really big part of what I was doing. And it was just coming out a little slower. And I was like, oh, this is so strange. And casually made an appointment. And then, you just fall into every little small category, which is just so wild.
Yeah.
Um,
Wow.
so
I didn't know that that's how you found it. So it was like part of, because I would think, I have friends that have had, done breastfeeding and maybe had like mastitis or something. And so, I that's really cool for you to share this, because I can only imagine that a lot of people going through that might not even like for that to be a sign. A lot of women I know, I would think probably would just think it's like something like mastitis or something little, like not thinking like cancer. So wow, that's
yeah. Yeah, and you're right. Those are the two biggest signs actually of breast cancer is reoccurring clogged ducts or a clogged duct that doesn't go away and reoccurring mastitis. So thanks for mentioning that. Yeah, those are actually the big ones, and it's not talked about enough, which is why I like to share my story.
for sure.
But I had it for like 6 weeks and it just wasn't clearing. And I was like, oh, this is so strange. And then I also had this tiny little itch, like kind of above my nipple line. And I thought, oh, it was December, it was like winter. And I was like, oh, maybe I just have some dry skin. But it was this weird, like nervy itch that like didn't really go away. And I was like, oh, that's really strange. And guess what? That was like right where my tumor, like close to where my tumor was, which is so strange. But when you go through that whole process, like I said, you don't assume you're going to be the one in 800 or one in 1,000 people. I know you've had your own, challenges and story, but it's pretty
Yeah.
wild when you find yourself in these small categories, but you're like, somebody has to be that number, right?
Yeah. That's, I mean, like I would never have thought like, and like the things you're describing, I can only imagine that so many women would just be like, oh, that's like, I can't even imagine myself thinking that that was like cancer. So like I love that you're sharing this, because that is like I love having people on the podcast that have overcome so many things and sharing their story of resilience. I mean, it's all about resilience, but it's like advocacy too. And I want people to know about things because of other people's journeys and like signs to look for and things like that, because you can't be resilient if you don't know about these things to like find the resources that you need. So wow, like that's incredible that I mean, do you feel like some of your background in I mean, you had to have some like healthcare background in you in physical therapy school. Do you feel like any of that contributed to you seeing it more than maybe the common person would think something of that or no?
I don't know, to be honest, because we don't really learn about that stuff. And I even, like I said, having worked like with breast cancer patients, working with an oncologist and a plastic surgeon in San Francisco, it still wasn't on my radar, right?
Yeah.
Especially at 35 with a
Yeah.
10-month-old and a almost 3-year-old. Like that just wasn't on my radar. I didn't have any family history. And I think that's the other biggest misconception that I like to share is everyone's like, oh, well, was it genetic? And I mean, I think we've linked like 10% of breast cancers to genes.
Yeah.
So there's so many people that don't have any that we know genetic links, right? So I think that's another big misconception is that, oh, well, this isn't going to be you because you don't have any family history. But there's
Yeah.
also just this random category of people who get breast cancer and there's no like known genetics. Like I had a whole giant panel, but really, I think the biggest thing is you have to advocate for yourself, like you said, right? Like I went into that doctor's office and in my head, I was like, I am not leaving this office until I have an ultrasound. And that's maybe where the medical background comes in helpful
Okay.
because I was like just determined. I don't even know why. I just was like, it's just weird. I just want an ultrasound. And, they wouldn't have done one, honestly, if I hadn't pressured. And I'm
Yeah.
so grateful to that primary care physician that she listened to me and she did an ultrasound. Because then, like I said, I fell in you have an 80% or chance that it's nothing or could just be like a benign blah, blah, blah. And then it's like, you have a whatever percent. And then it's like, you fall in this. I mean, I think
Yeah.
I'm in like a 5% of breast cancer category, the type of breast cancer I had. So,
Wow.
like pretty wild. So I
Yeah.
think advocacy is really huge and
Yeah.
knowing not to listen, like if you feel like your gut is telling you something is weird, like you need to push for imaging. And like if you don't get the answer from that physician, go to another physician. Like don't, because this is where pregnancy and postpartum breast associated breast cancer gets missed a lot is because it's like, oh, it's a clogged duct because
Yeah.
you're breastfeeding, or yeah, it's just mastitis. Let's just treat the infection, but like we're not getting the underlying cause.
Yeah.
So
I mean, that's pretty wow. Like, I can just imagine how much like this is gonna help just women know to look. I mean, women and men really. It could be any kind of cancer, but really to advocate for yourself when you know something, even if your head, like, even if you think, oh, maybe this is like impossible, but you know in your gut like something's off because only you know your body like better than anybody. It's like advocacy. I feel like that's such a thing like nowadays, especially in the medical system. Like you have to advocate for yourself because um doctors are seeing how many patients a day. Like they're like how you feel and what's different. And wow, that obviously like I would say that saved your life because you like advocated to get what you needed. So then once you had how long did it take when you get the ultrasound that day when you were at the hospital or at the doctor?
yeah, so the whole story is honestly kind of wild. It
Yeah.
was like everything was lining up too perfect, like that scenario where I was like, yeah, I really want an ultrasound. Like I just want to rule it out, blah, blah. So I had the ultrasound. Then they saw something, suspicious. So she said, we're going to do a needle biopsy. Let's get it done right now, this moment. And I was like, okay. But then the machine was broken or something. So then they got me in the next day. And then it was like, okay, we can get you in for, to get the ultrasound. Sorry, back up smidge. But when I was scheduling the ultrasound, it was like, okay, we can get you in tomorrow at 8 a.m. or we can get you in 3 months. Guess what? This was February of 2020. So
Oh my
right before the
God.
world shut down. So
That's
I was like, that's really creepy. I was like, okay, sure, I'll come in at 8 a.m. tomorrow, right? So you have to drop things, I think, for this stuff too, because if I had been like, oh yeah, sure, let's just wait 3 months, because it's inconvenient. I had to cancel a couple patients to get in. Like I said, the world would have shut down, and then who knows what if, everything was moving so much slower. So yeah, so definitely go in for the testing when they offer it to you.
Yeah.
But yeah, then I had the needle biopsy, and then, you wait for the lab results, and it ended up coming back with DCIS, which is like technically pre-cancer. It means it's just in the duct. It's like the best case scenario, but there was microinvasion, and microinvasion means it's just like a microscopic amount. I think it's less than 1 millimeter that has left the duct. So then they do more testing, right? And then I fell in the category of like, well, actually it is invasive. It was so tiny. So I consider myself a very unlucky person because I caught it early, but it had left my duct. So the moment it leaves your duct, it's another category because now it's free cells in, in your breast,
Yeah.
and it can go to your lymph nodes and all that. So then I had a lumpectomy, because I just wasn't ready to hear the whole double mastectomy. I wasn't mentally ready for all that. So I did the lumpectomy. I majorly failed. There was like 4 out of 6 margins were positive. So they around the tumor, they cut it out or whatever, they see, they cut it out, and then they tell you how successful it was. So you want to have clear margins, and I had like 4 out of 6 that were still positive. So it was way, way bigger than they thought, and it was more extensive DCIS. So then then they do more analysis of that, and then it ended up coming back as hormone negative, HER2 positive, which is it's a less common type of breast cancer. And I think that's the other misconception, that it's always hormone run. There's different types of breast cancer. So mine was not hormone related.
Oh, okay.
But it is known as the wildfire of breast cancers. So, unfortunately, when you're younger, usually you're in the more aggressive categories of cancer in general.
Hmm.
So, it was a really aggressive type. So, that's the thing. It really matters on how aggressive is your cancer? How fast is it growing? Is it slow growing, fast growing? So, you get all this kind of overwhelming data. That's really important because that, will just help you to make a decision on what route to go.
Yeah. And how
So,
fast you had, I mean, you got in and you did like you went with your gut and then you went with your gut again to do the appointment right away and then we're able to and that's the thing. I feel like so many people uh our medical system, it can be difficult to get in that fast. So yeah, that's really good information for people to have, especially I mean like I am 36 and I'm thinking like 35 breast cancer. Like I mean, I
mm.
know it's becoming more common. Like I don't know if it always was people getting breast cancer. I feel this young, but it does it I still feel like I'm young and I'm sure you did too and do too. It's like wow, like that's so fast to just have cancer could take you out so fast without being able to see this is a really fast acting cancer. So then once you did the double or you did the lumpectomy, but then did you end up having to have a double mastectomy or what ended up happening?
Yeah, so it was a whole, so then they found out it was hormone negative. So when you have hormone negative breast cancer, it's almost always chemo if it's invasive because it's a more aggressive type of cancer.
Mm-hmm.
And they can't use hormone blockers to block it. So the pros of it is you don't have to be on hormone blockers for 10 years. The negative of it is you usually have to do chemo. So then I did chemo for 3 months, cold cap to save my hair, which I was so grateful for. It
All
worked really well for me. Yeah, it's a freezing cold cap on your head you wear for 5 hours, 5 to 6 hours on chemo days. My husband was my capper. So you have to have somebody like put the cap on, you change it out every 20 to 25 minutes. And then, yeah, and that was, like I said, full blown COVID shutdown. So my father-in-law flew out to help with the kids. So it was like a whole ordeal. And then a month after that, they have you recover. And then I did do the double mastectomy,
right.
because my cancer was more extensive than they thought, and to play it safe, which it is kind of wild because once I had my test result back from my double mastectomy, they actually didn't find any cancer cells, which is kind of wild because you're like, wow, I just had both of my breasts removed and they didn't find. So it just means chemo worked really well for me.
Yeah.
But I mean, like I said, it's all cells, right? So who knows? So I don't regret it.
Sorry in that kind of a situation. I've always
Yeah.
they're like, if you can just get rid of the opportunity for it to spread. And I'm sure it's a personal decision and you know, that's a very personal decision to have to, go through all of that. But it, wow.
But honestly, by that time, that was what, July, I was like, get these things off of me. I'm so over you. I hate you. Like I had kind of a negative association to my breast, to be honest, by that point, because my lumpectomy looked horrible. There was like a giant divot out of my boob. I had been breastfeeding, so my boobs were larger, and then they sunk to like nothing because I had to stop breastfeeding that day when I found out. So it was like, oh, this doesn't look good. I'm like pretty over these things. So at that point, I was mentally ready. I wasn't mentally ready in February to hear like, but then it's a whole ordeal. You have to get expanders if you want reconstruction for a lot of people. For me, because I had smaller breasts, it just is like a whole ordeal. And then implants is what I chose. But, you have to make all these decisions. So it ends up being more like a year. And
Yeah.
then I ended up on an infusion for like 18 months.
Oh,
So
okay.
after chemo, I stayed on an injection for like a year and a half or 15 months.
Wow.
But like in general, I feel so grateful, to be honest, because I really didn't want to be on hormone blockers for 10 years. Like there's a lot of side effects from that, bone health, brain health.
Yes.
Um, I mean, there's no good choice, right? In the cancer world, it's just a bunch of crappy decisions you have to make
Yeah.
and try to pick the best one.
It's
So,
totally. I mean, that's honestly the other thing when I connected to the post that you posted recently about your journey with it and like the mindset thing and like how important that was and like I you might not even know this, but Neuro Wellness Community is the hub for resilience resourcing. So Neuro Wellness Community is all about brain health and like mindset, and it really goes into resilience and all of those things. And I did want to ask you about that, like the mindset during all of this. Like you talked about, like it's not toxic positivity. I loved how you said it's honoring the hard, but still choosing to move forward. And like how did you do that? And like what did that look like mentally and like emotionally for you?
yeah, I mean, you have more of the psychology background than me, but it's so important to allow yourself to grieve. Like I was mad, I was angry, I went through the normal grieving process, right? Which I think is fine. Like, but then at some point you got to get yourself out of that, right? Like this
Yeah.
is what I have to deal with.
Yeah.
And the amount of people that are like, oh my gosh, I can't believe, you did that. And wow, it's like, well, I didn't really have a choice. So don't say that.
Yeah.
But like, just be there for people, support them, let them complain and let them have their hard moments and then guide them or help with, whatever you can. But yeah, I think it's so, and this is what I see so much working with chronic pain and pelvic health and everything I see in the work world is you have to pull yourself out of that. Like I think, you can feel sorry for yourself, in my opinion. You can be sad, mad, like why me? Like I was healthy, I was a vegan, I went vegetarian, I've always worked out, I felt like
Yeah.
I did everything right. I always ate more organic, but it doesn't matter. Cancer doesn't really care. But
Yeah.
you have to, I think, yeah, like get into a better mindset, like looking at my kids, like I said, to a blessing, I'm kind of thankful I had young children because I couldn't just really putter around and lay on the couch and feel sorry for myself. Like I was a mom, right? I had to still take care of my kids even through all that. So for me, I think that helped a lot. And then I've always been really active. So, even on my crummiest days, I still walked the block or, I tried to just do a little activity, which was really big for me. And even at the chemo, when I went to chemo sessions, I would be like doing little exercises while I was waiting for my infusion, and I'd have my cap on my head, so I looked ridiculous, right? But it made people smile around me, and I
Yeah.
was like the youngest one, right? So all these older people were like, "Wow, like look at you," like I was just like, I'm sitting here, like coming here weekly, like I might as well do a little exercise while I'm waiting for this appointment, or they're dragging things out. So I
Yeah.
think, yeah, finding anything that gives you joy, looking at the positives of like, wow, okay, I caught it early. Like, this is like, hopefully I can get ahead of this. I can get my life back. I will get my life back. That
It's
really helped me.
yeah, how real you are and like vulnerable about like how you actually felt and what actually worked to help you, because like that's why I do this podcast, because so many people have gone through really hard things that we think until we end up in this situation, like how would I get through something like that? Like I can't even imagine, and then you just it's really been interesting to me that time and time again, I have people on this podcast, people who've gone through things that cancer, death, like, drug addiction, all of the things, like, so things that you think, like, how could you overcome that? And the similar answer is you can't pretend that it's not real. Like, that's why I call this the real and the way to resilience, because you do have to deal with the real. You have to feel it to heal it. You can't just pretend this is not real. And so you explain, like, that's part of what you had to do, is like, not just resort to just toxic positivity, but like, yes, this is hard, but then move forward and find ways to help yourself. Looking at the, like, gratitude is like a huge thing, and I see that with so many people. Like, even if you could find one thing, your kids, or catching it early and all that, like, that can help your mindset. And then, like, how you exercise, like, exercise, exercise, exercise. My mentor says that all the time. She's an exercise science major as well, so she's big into that. But like, that's such a mental thing. Like, it really does help you mentally just as much as it helps you physically. And so I can imagine that that was like, plus you're a physical therapist, so I'm sure like that already comes so now. Did you find it harder to be like, to do that, like, want to exercise during that time, or was it like you're already a coping mechanism that you've ingrained in yourself, so it was like a natural thing to go to?
It's a natural thing for me to go to, but I was pretty like I had a lot of issues with my white blood cell count. I was super weak and tired, and like you don't feel necessary. I didn't. I feel like I got through chemo, to be honest, pretty well, but I
Yeah.
struggled a lot with my levels, like my blood levels. So my blood pressure was like insanely low. I have low blood pressure anyway, so my blood pressure sometimes was like 85 over 60. I was like, am I even alive? Like, so I
Oh,
didn't feel like you don't feel. I felt a little dizzy. So it was stuff that I was struggling with. I had to do some extra injections to get my counts up, which were really painful, to be honest, and caused a lot of bone and joint pain. That was honestly pretty horrendous. But once I got that dialed in on like meds to counter it, it was a lot better. But yeah, I
yeah.
mean, it's crappy. Like it's okay to, like I said, assume. And I love the way you just said toxic positivity because it's true. Like, yes, we want to be positive. Yes, we have gratitude. Yes, we want to be like move forward, right? But it's true. Like you can't be toxically positive all the time. Like it does suck. And there's a lot, and I see patients with all sorts of weird chronic pain stuff all the time. Like I will tell them, I'm like, I hear you. This sucks. Like this isn't fair, but like trying to find solutions to help them move forward is what I feel like I've done a much better job at since I've gone through my own challenges. And I'm not
Yes.
perfect at it, right? Everyone has their own coping mechanisms, but I do think it's like really important to not be toxically positive, like to constantly tell people like, "Oh, you've got this. Like you're going to get through this." Like that's so obnoxious. Like you don't know if I'm going to get through this. You don't know if I'm going to die. Like that's so annoying.
And when
Like
you're smart enough to know, harder when you're like, okay, like, what are you, God? Like, how do you know that that's like,
yeah.
this is just as real for me? I've felt those things before when I've dealt with that too. I love, though, like, it's really interesting. You just kind of touched on something that, again, is what I see so much, and why I think people who've, I think there's a difference in somebody who's really gone through something difficult like cancer, or, something really like life altering like that. Um, the way you then start to treat other people, like, it does affect you. It does. I feel like it brings more empathy into your life and like how you relate to people. And I'm curious to see, like, because I've seen so many people that have taken like the hard that they went through and then turned it into good, like, for helping other people and their practice. And like, you were a physical therapist, but I believe you hadn't started the one that you did now. So like, how has it like affected your life, like how you are with your clients and stuff, and like just how you like took this big life thing and like turned it into, like, you're now a business owner and all of that as well?
Yeah. So yeah, no, I was working for a regular physical therapy practice, which I'm kind of grateful to be honest, because I was on and off gone for like a year, right? Which would be really, really hard with your own business.
Yeah.
But cancer or any, I think, life altering thing, and if you kind of get onto the other side of it, it's pretty tough when you first finish treatments, right? And I think that's a like a area that's not talked about much, right? It's like, okay, you're good, you're done with treatment, and you're like, okay, like you're, looking over your shoulder. You don't want to get too excited because you're worried it's going to come back. So I felt like I was not in the best, like, I was like nervous. I waited a year and a half, I think, to finally be like, okay, like I need to get out of the job I'm in. I am not happy, but I was scared, right? I wanted my life insurance benefit they gave me in case I died or it came back. Like, and I was so holding on to this disability and life insurance policy that was through my job, which I look back is so ridiculous. But it was just like, I think I needed to like be like, okay, I'm okay. Like I need to just like move on with my life, even if I don't have a life, because I couldn't get life insurance, right? Obviously, you're too much of a liability. They don't want to insure you. So I was like really holding on to that. But I was like, every day I was like, ugh, like I don't feel like I'm helping my clients like I want to help them. I'm hustling. Like I was over that hustle mentality, of like, let's get more people in the door, out the door. Okay, I've seen 15 people today. Like, I just couldn't do that anymore. So I think some life altering challenge really makes you reassess your life. Like, wow, what do I want? Am I happy? Like, what if I die tomorrow? Like, what do I want to spend more time with my kids? How can I make that happen? But I love what I do. I don't want to be a stay-at-home mom. Like, that's not for me. Like, it makes you reassess your entire life, I think. And for me, I found that was really a positive because I realized I was not happy where I was working. I was not happy in the environment I was working in. I had started a pelvic health practice and I was loving pelvic health, but I didn't like it in the way I was restricted by insurance and just the clinic flow. It was just burning me out. You didn't have time to go to the bathroom and it was like barely drinking water and you're just hustling between one patient to the next, to the next, to the next, throwing them to the aide. So I was just like, really over that. And I had no interest in starting a business. I've actually never wanted to have a business. But I just didn't really, there was no other jobs for me. Like I was like, what am I going to, like, there was no job that sounded appealing. So one of my best friends is a massage therapist and she was like, Laura, you got this. Just start your own thing. And all my coworkers were so negative. They're like, oh, that's never going to work for physical therapy. And people are never going to pay out of pocket for that. And so I had a lot of negativity. And that's where, like you said, the great gratitude comes in and trusting yourself and being like, wow, like I can do this. I know I'm a great therapist. I care about my patients. I know I can connect with people. Like I've got this. And then I
Yeah.
just took that leap because it does, like you said, it makes you reassess your life. And I think sometimes that's a positive because instead of going through another however many years holding on to a pension plan or disability or insurance, it kind of is like, wow, like life's not guaranteed, right? So do I really want to do this for another however many years because I'm worried about losing a benefit? So I see that all the time now where people are like, well, I can't leave because I have this loan repayment thing, or so I got to be here 6 more years, or I'm scared because I don't want to have my own medical insurance. Like you can do it. Like it's not,
Yeah.
if you set your mind to it, and learn and grow. So
Yeah.
yeah, so that was kind of how I just kind of was like, I got to get out of this and I need to build a better quality life for myself.
And look at how, like, I just see that as, like, again, I've kind of been watching from the background, like, just, on socials and stuff. And, like, um, it's incredible to see, like, you know, even, I mean, I'll just get personal too. Like, you're a pelvic floor therapist, you do pelvic floor therapy, right? There as well. And, I have had the journey with endometriosis, and this is a whole new, thing for me, and so I've seen that's kind of why I've been following your page with your business. But a lot of what you shared is helpful for somebody going through endometriosis, and it's very uh, it's like empowering to women to like have resources. And so, like, you think about like the story and things that you went through, and the resources that you needed to be successful to get there, and then like how you are now someone who is a advocate and resource for people. And I truly believe like you starting this practice and doing it like this way is giving you such a reach that like you didn't probably wouldn't have had you stayed in the comfort zone. And it's like, I think that's amazing because I keep seeing that with people who've really gone through something so life altering. There's like this pull to like get out there and give like what they're truly called to, and like help people in that way. And I think, it's cool that it met your needs as well. Like it took you away from like not having to do things in the specific structure that it was set up, Western med style, but it was like you can now have more freedom in your daily life and impact with your children and time with them. Like that's incredible.
You you need to be in a good place yourself, right? If you're caring for people and treating people. And when I was coming back from cancer treatments, I was kind of resentful, right? I was like seeing this elbow pain and they're like, "Oh, I have 2 out of 10 pain." And you're like, "Wow, I was finding myself a little resentful, which is so not me. I just never been like that.
Yeah.
So I dove more into pelvic health and like started that program, and I was doing better with that because it felt like more significant issues, you know. But
Yeah.
it's so important to be in a good place yourself. I think especially when you're in like service industry and caring for people, like if you're not in a good place, you can't give that vibration and help to other people. So
100%.
me not being happy at work and feeling like a work mole and just like a number, like that wasn't a good environment. And as
Yeah.
much as I loved helping everyone, and taking insurance, it was just like, this isn't sustainable for me. Like, I can't, what am I going to do for the next 30 years? I'm going to do this. I just had that in my head. And I was just like, I can't do this way. And I
Well,
was
and
frustrated every day leaving like clients. I was like, gosh, I could have done this, and that. There were so many more things I wanted to do, and I just couldn't do it. So,
that's what I was gonna say. With the way that you do things, and a lot of people have, found that within the system and what they're able to do in the 20 minutes they're given versus being able to have like, I think they call it boutique style, or having it your own practice, where you take, people pay as they go instead of, insurance or whatever. But it gives you so much more ability to help people and have more time to be more in depth and like um it's just interesting. Like as I listen to you, I'm like, certain things changed because of all, this life altering thing, and made you reevaluate things for your own, um that made your lifestyle, made you feel better overall. But then it also has made like, you taking care of yourself is actually what's helping other people more. Like, and
mhm.
that's I think that's a huge life lesson. Like, what aligns the best with your life and is going to give you the best, people call it vibe, energy, whatever you want to call it, but flow state, that's what my mentor calls it. But like when you're in flow state because you're doing things that align with your lifestyle and what you want, it is just natural that you're going to have an impact, like more of an impact, because you're not doing it you're not having that, like you said, like just kind of like, you know the word you used, but like feeling kind of like, oh my gosh, like I don't want to work on somebody like too level elbow pain. Like this is feeling kind of like, I'm not saying that people have dealing with that is not, hard, but with what you went through, like you felt like you had more to give. And so yeah, it's pretty cool to see. Is there anything else that you just feel like in the journey that you think would help people to know when it comes to their own like resilience, overcoming, if it's cancer or if it's a health scare, or if they are wanting to start their own business and or in a specific um industry and wanting to kind of branch out, like any of those things within your experience that you would like want to share with someone else?
Yeah, sure. I mean, I've gotten really into business coaching and personal growth and vibration and all of that.
Yeah, love
It's
it.
just been so amazing. And I think we limit ourselves so much, right? We think this is just my life. Like, this is what, like, I'm going to this job every day, Monday through Friday. Like I said, I have my pension plan or my insurance plan. And I
Yeah.
think like what I'm learning is we can do so much more, right? You can have so much more impact if you want to. Like you can do it if you put your mind to it. It's scary, right? You nailed it. You said you left that comfort zone, and it is terrifying to leave a comfortable, good paying job with, like I said, security to go do your dream or your passion. But
Yeah.
to me, it's like you only have one life, right? So as long as you're not making horrible decisions, I think it's good to take some risk, right? And that I've never been a risk taker. I've always been very cautious. I even started my business, I was very, very cautious the way I did it. And I'm
Yeah.
slowly learning just to trust my gut and like go for things a little bit more. But
Yeah.
I think it's so important to, yeah, learn. Like we have to learn and grow as an individual, like to be a better mom or be a better human or treat other people. Like we need to put more time into us, like you as a person.
Yeah.
And as a business owner, right, it's really easy to get burnt out and like to be overwhelmed all the time. And, you want to try to stay in this more positive state
Yeah.
of like rejecting what you're not liking and trying to stay like focused on what your goal is. Because I think it's so easy to get sucked into the day to day, like, oh, like this and this went wrong today. Okay, this happened today. This isn't going well, like versus like what is going well, And I think that's important for health journeys too. Like you said, it's like trying to find the little thing that maybe is going well, even if you're going through a hard time. So I use that in my personal life. I use that with like, especially like my complex chronic pain, pelvic pain, patients. Like I think endo like anything where it's a disease process, right? You can learn to manage it. There's a lot of things you can do, but I think it is important to try to stay in a little bit of like a focused mindset of like what do you want and that you can accomplish that.
Yeah. Keep
um
like you said, it's honoring the hard, but keeps you moving forward. Like that. I love how you said that because it really like that hits the nail on the head because it's like not ignoring the hard, the pain, like, but also like looking you if you want to feel better mentally, even you got to find something to focus on. And it's like you're saying, like just finding those little things. And like you even talked about what you just explained is like boundaries. I'm using psychology terms, but really it's just like boundaries, like where you're putting your time is more. It looks like that's kind of what happened. You got more like laser focused on these are the things I want my time to be used for, these are the things that I don't want my time used for, and like how to navigate that more. Do you feel like this experience like empowered you to have more clear, I mean that term can be overused too, but like do you feel like it helped you have some more clear boundaries on like where you put yourself as well? Because you said it is you're not a risk taker, so that like expanded your horizons as well, but then it also like kind of did both, it seems like.
Yeah, no, it's so true, right? Like, what do you want to put your energy to? Like I said, we could be frustrated and mad about what's going on, or you can try to focus on, wow, like let me just enjoy the sunshine today and like let me go sit in the sun, even if I can't do what I want to do, right?
Yeah.
Same, like I think trying to find an ounce of good, because like I said, if all day you're focusing on, gosh, my vagina, whatever, I'm having this horrible pelvic pain, my abdomen is cramping, like nothing's going well, I can't eat, I can't do this, I can't do that, like that's gonna keep you in more of that like negative, like that's gonna attract, you're gonna attract more of that negativity, in my
Yeah.
opinion. So trying to set more clear boundaries of like, first of all, taking time to acknowledge some of the good, I think can be helpful, but also setting a clear boundary of like, I will do this today, like setting habits, like I'm going to make time for myself. I could, pre-cancer, I was in that total hustle, like, let me zip out of the door, bring my kids to daycare, rush to work, rush back. I wasn't
Yeah.
making time for myself, and now I'm better. I'm like, hey, I'm going to go surf this morning. Like, I went and surfed this morning. And then I
Yeah.
made it back to say bye to my kids as they went to school. And then I came to work. Like, that's what I want, right, for my
Work life.
life.
Yeah.
And then being like, hey, I'm going to go work out today or whatever makes you feel good. I'm going to listen to music in silent. I'm going to sit in silence. Like, you have to find what feels good for you. But I think it's so important to set new habits and like build those into your routine versus like it's so easy for us to just like zonk out in front of the television and watch mindless television or scroll forever on mindlessly on our social media. And I do it too.
This is totally true. It's like you can make this life, like you're the only one that can make the decision to, prioritize. You have to get up a little early if you want to go surfing before you take the kids, like, or, you can look at it like I get to orchestrate my life and make it into, you know, even if it's you only get 15 minutes to go out and surf, you got to have that like moment to start your day and like that mindset. I can only imagine that's a good mindset like to start out the day with. It's like those little I mean different people call them like glimmers or different things that you can like hold on to that bring you joy. So wow, you're full of all kinds of wisdom and like amazing resources for resilience that people just listening to this, I'm sure, are going to be so encouraged and empowered to like take hold of these things and make even whatever the hard situation, it might not even be as difficult as cancer that someone's going through, but these things are universal. I really think they help anyone going through hard times. I can't thank you enough for being on here and just being willing to share your journey, vulnerable of everything you went through, and then now where you're at. Like, it's just the sky's the limit. And it also, you did say at the end of that post, like, you can always continue to like self improvement or like personal growth is like kind of like there's no end to continuing to grow and become like more of what you feel like is authentic to yourself. So thank
Yeah.
you so much.